While I was doing my residency, there was a young male. He had monoparesis of left arm for 2 days. He did not have any comorbidities. So I instantly thought it can be neuritis of brachial plexus. Although it is not a common diagnosis that I see often, but I don't know why I thought it can be neuritis. Instantly I thought neuritis and ordered steroid. The next morning my senior came and saw the case. He took history from patient. He did not have any risk factor for stroke, but my senior told me you should think of common conditions first. So what is the common cause of paralysis? Stroke, right? So you should have ordered CT scan of his head to look whether there is a stroke, because this is the common thing that we see. So we are trained to think that symptoms may be due to common things like common diagnosis. So how often do you see neuritis? He asked me. Actually, I have never seen brachial plexus neuritis, but I don't know why I thought at that time. And he ordered CT scan. It was negative. So why I am telling this scenario is that we are trained to think common things. Don't think of rare things. Like rare diagnoses are rare, right? Common diagnoses are common. But it can be neuritis. It is not that rare things does not occur, right? So this is called zebra retreat. So why it is called zebra retreat? That when you hear hoofing sound, think of horse. They say like that, right? When you hear hoofing sound, think of horse, not zebra. So when you see common symptoms, think of common diagnosis, not rare diagnosis. So this is the teaching that we get in medical practice, but it is not like that always. We can have rare diagnosis as well, right? So we should also think of rare diagnosis. I mean to say that if we don't think of rare diagnosis, we can miss it, right? It can be rare diagnosis. So in addition to thinking common diagnosis, we have to also think of rare diagnosis.